warm welcome to the 20th webinar of the webinar series on adolescent and youth. I'm Sharon Augustine, moderating the webinar on developing road safety as a life skill in students. Like every webinar, here is a survey on your screen. Please fill it, and it is also open for the panelists as well. Those of you who wish to listen to the webinar in Hindi can switch on to the Hindi interpreter. Thank you so much. The webinar will start by 4:04.
Good evening, everyone. I, Alisa Hassan.
And I am Sharon Augustine. We will be moderating the webinar today. I once again welcome all the panelists, principal teachers, public health professionals, and especially the health ambassadors.
Let me introduce you all with SHARP. SHARP stands for School Health Annual Report Program. It is a non-governmental pan-India health organization, and we have recently completed 21 years in the field. We work for the healthcare of students and children, which is professionally managed by eminent psychologists, nutritionists, counselors, and people like you and I who have vision to promote healthcare.
Approximately 1 lakh people out of 1.6 lakh people dying every year because of road accidents can be saved if they receive some emergency care within the golden hour. But in most of cases, people do not help the victim due to their apprehensions or not being aware of the emergency medical practices. As a part of Road Safety Month celebration, this webinar focuses on how we can develop road safety as a life skill amongst school students, especially as a bystander or as a close relative or friend.
COVID-19 has left a big room to discuss over the subject. For the same objective of discussion, we here have with us our esteemed panelists, Dr. Sushma Sagar, Dr. C. Naveen Kumar, Ms. Neha Kullad, and Ms. Jujula. We welcome you all. Few instructions before we go further. We will let each panelist speak first, then we will have a question and answer round. All the questions in the Q&A will be taken live. Please drop questions in the Q&A box with the name of the panelist you want to ask the question to. The sharpest question from the audience will be given a gift voucher of rupees 1000 from Sharp. Also, I request all the attendees to not flood the chat box with unnecessary messages as we tend to miss out the important ones.
Without further ado, we invite our first panelist, Dr. Sushma Sagar. She's a professor at the Division of Trauma Surgery and Critical Care at JPN Apex Trauma Center, AIMS, Delhi. She's also a course director and a course faculty for Advanced Trauma Life Support India program. She has also authored a manual for road safety program in India. We are glad to have you here, ma'am. Over to you, ma'am. Desktop पे है ना? Ma'am, you are on mute.
Thank you so much, Sharon and Eliza, for a wonderful introduction and taking this initiative. It is indeed a very important step that you are taking today during this Road Safety Week. And road safety is one issue which I think now the time has come that it should now start from the very grassroots level, that is from the school students. Because despite of many efforts by the agencies, by the hospitals, by the Ministry of Road Traffic and Transport, a lot has to be done. And what we realize is that the main crux lies in the behavior of the population, because until unless we start following our road safety rules and regulations and we improve our behavior, we are not going to lessen down the numbers which are increasing day by day. And it was very disheartening during the period of pandemic that everything stopped despite trauma. So when the roads were empty, we had more severe trauma and people were driving more in a more rash behavior. And the problem is growing day by day. And if you allow me, I want to share a few slides regarding this. Can I share my slides?
Oh, ma'am.
Sure, ma'am.
So very quickly, I would like to is my slide visible?
Yes, ma'am.
Yes. Okay. So like I just said that during lockdown, when everything stopped, the accident and the trauma did not stop. And you all must be now aware of these red zones, orange zones and green zones during the COVID time. And everybody feared going to the red zone. But in trauma, this red zone never diminished. And red zone is the area wherein we find people with life-threatening injuries. You have injuries wherein you can lead a life of a vegetable throughout, and you will not be able to come back to your normal routine activities. And if you see that there are various modes, I mean, whether you are a two-wheeler or you are a pedestrian or you're riding in a car or wherever you are bound to meet an accident once or twice in your lifetime. And you all must have had all your relatives, nears and dears meeting trauma every day. The basic cause of having so much of burden of trauma and accidents in our country is the multiplicity of the road users. You would find that on the same road there would be a bullock cart, a tractor or a Mercedes going on with a very high speed or with a very low speed, which is very unusual, which we find in the Western countries. Many of our professors now say that trauma or injury is like a genocide. You know, it is silently killing our young population. And it is very pity to see that young kids, students of schools and very young adolescents riding on the bike without the permission of their parents, and then without wearing the helmet, and then meeting with the accident, coming to the trauma center either with a severe head injury or losing their arms, losing their lower limbs, or having severe injuries to their genital organs, and which leaves such a bad scar, not only a physical scar on their life, but a mental scar too. And apart from various fatal injuries, you see, like if you find one person dying of road traffic injuries, you'll find that there are 70 behind him who would be suffering a lifelong morbidity because of the trauma and accidents. There are various other reasons also for meeting with the injuries, but road traffic accidents or road traffic deaths is something like crashing of a Boeing plane every hour. I mean, the burden is so high. Another problem is that person not reaching to the hospital in time. Like Aronik said in the beginning, that this golden hour concept is very important. And timely and in a proper manner, transfer of a person to the hospital is very important. And for this, India lives in two times. There are places wherein you would find people being transferred in a sheet of through a sheet of cloth, and there are places wherein you patients are airlifted. So we live in two different kind of a zone. But the best way to shift a person is to scoop and run. I mean, as soon as you find a person lying on the road, you immediately recognize that he needs a medical care and shift it to a nearby center. And here comes a role of bystanders. All of you young students and adolescent population, those who are all the time on the roads for various reasons, for your studies, for your job, or for other things, you are the ones who can actually save these people. So the bystanders, if they know the basic techniques that how a patient can be shifted to a nearby hospital in a timely manner, can change the outcome of a person. And we all must know that there is a Good Samaritan law, and that Good Samaritan law says that if you take a person in time to the nearby hospital, then the hospital is not going to ask any questions from you. Rather, you in Delhi, they have started a reward for that. That if you will bring any road accident victim to the hospital, you will be given some kind of a reward or some kind of a recognition for that. So this is a Good Samaritan law, and I request all of you to try to follow this Good Samaritan law and try to shift a person to the nearby hospital if you happen to see any accident when while going on the roads. Now, we all think that the first aid kit, which is required to help these people, is something which is very non-affordable. But now COVID has taught us that nothing is non-affordable. I mean, and India is famous for jugaad. You can do jugaad with everything. If you don't have a spine board to shift your patient to the hospital, any wooden board, even I would say the white board in the school can be used as a ट्रांसपोर्ट बोर्ड, एज अ स्पाइन बोर्ड. अगर आपको कुछ भी नहीं चीज समझ में आ रही है, कोई भी लकड़ी का फुटा, कोई भी चीज आपको पेपर का रोल मिल रहा है, कपड़ों का आप उसको रैक बना दीजिए, आप न्यूज़पेपर यूज कर लीजिए. सो दीज आर द थिंग्स विच यू कैन यूटिलाइज to make your patient in a proper stable position and shift him to the nearby hospital. So you feel that there is only gloves and spine board and bandages which are required as a first aid kit for these patients. Important thing is how you take out that person from the car or from the entrapped vehicle. You can take a help of the person. Now, 4 things have to remember as a basic life skill for any emergency care, whether it is a flood disaster, whether it is a road disaster, whether it is an earthquake, or whether it is any kind of a fall. And those 4-letter words are A, B, C, and D. Now you all would laugh that what is this ABCD? वो तो बचपन में बहुत पढ़ाई करी है हमने. So A is airway. Airway means any person should be able to take the air inside. और air अंदर लेने का मतलब है कि oxygen वो ले पाए. So 1 is airway. From B we mean is breathing. हमने सांस तो अंदर ले ली, but क्या वो सांस हमारे lungs में पहुंच पा रही है? That is breathing. सी इज सर्कुलेशन, हमारा पल्स और ब्लड प्रेशर ठीक से चल रहा है कि नहीं चल रहा है, क्या हमारी बॉडी में से ब्लड का लॉस तो नहीं हो रहा है, हैज द पर्सन गॉट इंजर्ड सो मच दैट ही इज ब्लीडिंग हेविली ऑन द रोड. एंड डी इज डिसेबिलिटी. यहाँ पे जो डिसेबिलिटी होती है, that disability is not physical disability, that disability is neurological disability, means उसको head injury हो गई है. So if we try to take care of these four things of any victim who has injured or has met with any kind of trauma, then these four things have to be taken care of. First is maintain a proper position. सब कहीं भी आप किसी भी जने को आपने किसी भी दुर्घटना में देखा है तो सबसे पहले आप उसको सेफ जगह पे ले आइए. अगर रोड के बीच में है तो रोड के किनारे पे ले आइए, पानी के पास है तो पानी से दूर ले आइए. सो ट्राई टू मेक हिम लाई स्ट्रेट, सुपाइन लीजिए. और अगर उसके मुंह से खून निकल रहा है, इफ द पर्सन इज वॉमिटिंग, तब आप उसको करवट से लेटा सकते हैं. दैट इज नोन एज अ रिकवरी पोजिशन. और जैसे ही आपने उसको उस स्थान से लटाया, सबसे पहले हमें गर्दन का ख्याल रखना पड़ता है, बिकॉज हमारी जो गर्दन की जो रीढ़ की हड्डी होती है वो बहुत ही नाजुक होती है. एंड इफ दैट गेट्स further compromised or further mishandled during this transportation, then a person can become paralyzed. उसके चारों हाथ पैर जो है वो पैरालाइज हो सकते हैं. So now what to do for the airway? एयरवे के लिए जैसे ही आपने उस व्यक्ति को देखा, आप अपना हाथ या कोई रुमाल या कोई कागज का टुकड़ा उसके नाक के पास ले जाके देखिए कि क्या उसके मुंह से सांस निकल रही है, क्या उसमें से कुछ हवा आ रही है. और अगर हवा नहीं आ रही है तो जैसा कि आप इस पिक्चर में देख सकते हैं कि इन्होंने उसका चिन लिफ्ट करा, उसकी चिन को ऊपर करने की कोशिश की. अगर उसकी टंग अंदर को जा रही है तो टंग को थोड़ा सा बाहर निकाल के, और इस फोटो में देखो कि वो उसको मुंह से मुंह सांस लेने की कोशिश कर रहे हैं. COVID times में you all might think that this is not possible, then you can place a piece of cloth or anything or a piece of paper between his mouth and your mouth and you give 2 rescue breath. आप जोर से उसके मुंह में 2 सांसें देंगे और उससे उसका जो है एयरवे अगर किसी वजह से चोक्ड है या बंद है, वो एयरवे उसका खुल सकता है. So this is how we take care of the airway. Second thing is breathing. क्या वो सांस ले पा रहा है? सांस ले पाने के लिए यदि आप उसकी चेस्ट वॉल को देखें, वहां पे अगर आप उसकी शर्ट हटा के देखें या उसने जो भी कपड़ा पहना है उसको हटा के देखें, तो आपको लगता है कि जब हम सांस लेते हैं तो हमारी छाती की मूवमेंट ऊपर नीचे की तरफ होती है. तो क्या वो मूवमेंट बहुत जल्दी जल्दी हो रही है या वो मूवमेंट बहुत कम हो रही है? दैट इज इंपॉर्टेंट एंड दैट यू हैव टू टेक केयर ऑफ. You cannot do anything as a lay person, as a bystander. You can simply recognize the emergency, that whether it is a very emergent condition or you can still wait for a help to arrive. Third thing is circulation. जहां भी कहीं आपको खून बहता दिख रहा है, the only thing which is required from a bystander is to apply a pressure. आपको यहाँ पे खून बहता दिख रहा है, आपको जो कपड़ा मिल रहा है, see the infection is not important here. कोई भी कपड़ा आपको सड़क पे पर मिल रहा है, आपकी शर्ट का कपड़ा है, साड़ी का कपड़ा है, दुपट्टा है, सिंपली अप्लाई अ टाइट प्रेशर बैंडेज. यहाँ पे हो रहा है तो यहाँ पे प्रेशर लगा दीजिए, यहाँ पे है यहाँ पे प्रेशर लगा दीजिए, पैर पे है पैर पे प्रेशर लगा दीजिए, गले से खून निकल रहा है गले पे प्रेशर लगा दीजिए. सो डायरेक्ट प्रेशर लगा के आप उस पर्सन को अस्पताल में टाइमली पहुंचा सकते हैं, बिकॉज ब्लड लॉस इज अ वेरी क्रिटिकल स्टेप इन सेविंग द लाइफ ऑफ अ पर्सन. कुछ लोगों को इसमें सवाल आएगा, आई थिंक वी कैन टेक अप द क्वेश्चंस लेटर ऑन. एंड जब हम चेस्ट की बात करते हैं तो एक बात आती है सीपीआर. एवरीबॉडी मस्ट हैव हर्ड दिस वर्ड. सीपीआर इज चेस्ट कंप्रेशन, जिसमें कि हम अपने दोनों हाथों को लेते हैं, इस तरह से अपने हाथों को आगे पीछे रखते हैं, पीछे एक हाथ से हम उसको बांध लेते हैं और 2 हाथ करके, और ये इसको हम हील पैड बोलते हैं. इस तरह से हम ऐसे बना के, और छाती के बीचों बीच आप अगर इस फोटो में देखें तो यहाँ पे हमारा गला जो है वो खत्म होता है, और उसके बाद इन्होंने बीचों बीच जो है अपने हाथ को रखा हुआ है, और इस तरह से करके हम रेस्क्यू ब्रेथ देते हैं, इसको सीपीआर करते हैं. आप ये देखिए कि इसमें एल्बो जो है बिल्कुल मुड़नी नहीं चाहिए, और कंधे से यहाँ से जोर लगता है, और जोर लगा के मरीज को आपने फ्लैट सरफेस पे लटा लिया, आप बैठ के या खड़े होके, और आपको 30 कंप्रेशंस देनी होती है. सो 30 कंप्रेशंस एंड 2 रेस्क्यू ब्रेथ. 30 बार आप इस पे करेंगे. 1 2 3 4 5 6 7 8 9 10. सो इस टोन में आप काउंट करते जाएंगे. यू काउंट फॉर 30 compressions, and as soon as your 30 compressions are over, other person can give 2 rescue breaths from the mouth. So this is a cycle wherein 3 chest compressions along with 3 rescue breaths are given, and in the meantime you expect that you should get some kind of a help. Now disability is basically to assess the brain function, और उसका सिंपल सा तरीका है कि आपको जो भी वो एक्सीडेंट विक्टिम या जो भी क्रैश विक्टिम मिल रहा है उससे आप सिंपली पूछिए व्हाट इज योर नेम, and if your person is able to tell the name, supposedly I asked you what is your name और आपने बोला मेरा नाम रमेश है, so that means कि your brain is functional, आपकी बॉडी में ब्लड सर्कुलेशन है, आपके ब्रेन को ऑक्सीजन मिल रहा है, and you are able to talk, तो आपका एयरवे भी चोक नहीं है. So are you okay? Yes, I am okay is a very important step in knowing that your person is life is still salvageable. This is a wrong method of transport of any person. इसमें spine जो है वो मुड़ी हुई है, so your person should always be transported on a flat spine board. अगर कहीं पे भी कोई external wounds है, again you have to apply pressure. अगर if you find that some person has got some piercing object, whether in the eyes, whether in the ear, whether here in the abdomen, do not try to pull out the object. Take the person along with the penetrating object to the hospital. Let the doctor remove it in the controlled environment. These are the splint and bandages. If you find that any body part is moving haywire, I mean there is some fracture or something, you simply strap that thing with any solid object. And if you are not finding anything, simply strap it with the body part. आप उसको body के साथ चिपका दीजिए, and that will act as a splint for that person. For fractures arms and legs, if you are not trained, you simply can hang it in a bandage. आप उसको लटका दीजिए. Otherwise, you simply put it over the body part and transport it to the nearby hospital. So this is all in short, and rest we can discuss during the question answers. Thank you.
Thank you so much, ma'am. It was very useful tips that should be known to all of us. And you told us a new meaning of ABCD that is very important for every adult to know. Thank you so much, ma'am. I would like to welcome our next panelist, Dr. C. Naveen Kumar, working as a professor and head community psychiatry unit, adjunct faculty, Center for Psychosocial Support and Disaster Management, consultant for forensic psychiatry services of NIMHANS, telemedicine services, free legal aid services by NIMHANS, having a research experience of working on 235 publications in peer-reviewed national and international scientific journals, a receiver of Marfati Award, S.S. Jairam Award, Professor Raghuram Distinguished Young Teacher Award, and many more. We are glad to have you here, sir. Over to you.
Oh, thanks. Thanks, Sharon, and thank Aliza. As Madam, I'm not using any PPT. I'll just speak a few words. And again, I would like to thank the organizers for having given me this opportunity, and also to have brought the issue of mental health in these kind of disasters, and for realizing its importance. So,
Sir,
as
sorry to
ma'am was saying,
interrupt you. I guess we are not able to see you. It would be great if you can switch on the camera. Thank you.
now,
Thank you. Yeah. Thank you so
yeah,
much.
yeah. So, what I was telling is the importance of handling the psychological trauma as well. But of course, the psychological support will not be possible for those who are unconscious or whatever, as ma'am was saying, the ABCD and other things. But many a times, what happens, people they receive trauma also mentally. So as ma'am was discussing about the first aid, most of it pertain to the physical issues, but also there's a growing realization about the psychological trauma as well, and therein lies the importance of something called as the first aid psychologically, or it's otherwise called as a psychological first aid. So this concept of psychological first aid is given by the WHO, and a lot of information is available on the net, and those who are interested can actually go through that. But whatever I would like to just in a couple of more minutes, I'd like to talk about what is PFA and what is not PFA. And then what are the kinds of reactions that are seen in disaster situations, and what best we can do. in those situations, and why is BFA essential? That the principle also we have to understand. So when it comes to the definition of psychological first aid, it is nothing but a humane and supportive and giving the humane and supportive and practical assistance to fellow human beings who have who may have recently suffered exposure to serious stressors or disasters that we may call. So what it involves, basically the components of psychological first aid are that it includes providing non-intrusive support, support which is practical in nature, by way of assessing the immediate needs of the person who is there in that particular situation, and helping them address the basic needs such as food and water. And next thing is to give a patient listening, to the person's needs and concern, but not pressurizing that particular person, and comforting them and helping them to stay calm in those situations, and helping those people to connect to information, services, and social supports at that particular point in time, and of course protecting people from further harm. So this is the psychological, this is in a nutshell what psychological first aid means, and what psychological first aid is not. That point also is important. It is not something which only professionals can do. As ma'am was saying, it is road safety is everybody's business. Likewise, psychological first aid also can be learned very easily, and any person who has some inclination and interest will be able to carry out these processes. And it is not professional counseling, and it is not a detailed psychological debriefing. Now, this term debriefing means a detailed discussion of the distressing event, and that is not part of the psychological first aid. Psychological first aid is a here and now thing, wherein the person is just available to take care of the immediate needs, and then connect that person to wherever the services are available. It is not asking people to analyze what happened or put time and events in order. Although psychological first aid involves being available to listen to people's stories, it is not pressurizing people to tell you their feelings or reactions to an event. That is very important. Now, of course, when you look at the place of psychological first aid in overall mental health and psychosocial response, it comes somewhere in the second or the third steps, because at the basic level is the advocacy for good humanitarian practices like basic services that are safe, socially appropriate, and protect the dignity of individuals. And of course, the next level is to activate the social networks and be supportive. Child-friendly spaces is one example for that. And basic emotional and practical support to select individuals. This is where the psychological first aid comes in. And at the next level, provision of clinical services by professionals. So when it comes to responses to see the crisis events, what are the psychological responses? That if we can go, I mean, people may have very different reactions to an event, and various factors do response to various factors are responsible for different responses from events. A few other points I'd like to mention, that these can be called as the principles of emotional support. Now, what are these principles? That is, no one who experiences the event or witnesses the event is untouched by it. So everybody may have some or the other, some quantity or the other, as when it comes to psychological problems. Uh, Most people pull together and function during or and after a disaster, but their effectiveness may be diminished. Another thing that one needs to keep in mind is that the reactions or the disaster stress are normal responses to abnormal situations. That is one point, but we need to keep in mind when we do the psychological first aid. Disaster mental health services must be uniquely tailored to the community. I mean, of course, it's a larger point, and the interventions must be appropriate to whatever the manifestations are. Now, what are the reactions? Psychological reactions. It may be panic, tension, or fear. The event happens so suddenly that there's no time to think as to what is happening. So the immediate reaction is to run for safety. Fear is the predominant feature seen in this seen during these disasters. The other feeling is shock, feelings of shock or numbness. That is, there is some sort of a difficulty and a sort of confused thinking in accepting the reality of the situations. Survivors may react as if nothing has happened. The person may become even numb. At the same time, psychological and physical reactions such as confusion and loss of appetite may also be present. For some, there may be survival guilt also. So, what is to be done? As I've already told, that you should, I mean, we can actually provide some support in the sense to actually listen to them patiently, and then provide them comfort, and then link them to appropriate services and needs, assessing their needs, and then so how to do this? What are the techniques that are used? One technique is called as ventilation. That is, what does ventilation mean? Ventilation is listening carefully and attentively, maintaining the eye contact of the person, acknowledging the distress without interrupting but not pressurizing, as I was already telling. If they are crying, allowing them to cry and not asking them to stop crying, and and providing support by physical touch, like holding hands or patting on the shoulders when someone cries. Of course, the cultural barriers of the community should be kept in mind in this regard. So that is one technique. Empathy is another technique that I want to stress upon here. This technique involves perceiving things from the other person's perspective and understanding or realizing what the other person is going through. So being empathetic will actually increase the effectiveness of the reactions that may be seen during that particular situation. Listening, active listening is another important technique that I want to mention. That active listening or a good listening is an important skill to provide emotional support to the disaster survivors. Um, of course, there will be lack of privacy and silence while talking to people, but as far as possible, these interventions can be carried out in whatever privacy that is available. Of course, if the time permits, I mean, of course, I wanted to talk about relaxation and recreation, but of course this is not a part of psychological first aid, but for those who may require a simple relaxation techniques also can be thought. So I think I would stop at this and wait for the questions. Thank you.
Thank you so much, sir, and thank you so much for letting us know the concept of psychological first aid and the components which it has, and also uh, what all we can do as a bystanders, and what are the emotion of the victim and the survival. Thank you so much, sir. Moving on to the next panelist. Our next panelist for the day is Miss Neha Kullar. Currently, she's serving as a consultant in State Road Safety Cell, transport of at the Transport Department at the Government of Rajasthan. She has 12 years of experience as a development sector professional in an NGO for road safety. She is also a certified road safety auditor by MOD, Indian Road Congress, and IIT Delhi. And she has a certification in road safety management by Birmingham University, UK. We are glad to have you here, ma'am. Over to you.
Thank you so much, team Sharp NU, for having me here. And my co-panelists have very wonderfully explained the concept of first responders training and the concept of basic life support. My talk and my presentation will focus more on the part of education awareness about the Good Samaritan law. So before joining Transport Department, I was working with Muskan NGO. So there I have been involved into different activities. So I'll present a case study from that uh, uh, NGO itself. I'll just share my presentation. Is the screen visible?
Yes, ma'am.
Yes,
visible
ma'am,
now.
it's visible.
So I won't go into the concept of Good Samaritan. We all know what it is what it is to be a Good Samaritan and what is the history of Good Samaritan. So basically, there is NGO Save Life Foundation which were fighting a PIL in Supreme Court, wherein this judgment was passed in 2016, and later this law was also included in Motor Vehicle Amendment Act 2019. So I will share what Rajasthan government and Muskan NGO has done for the education awareness of this law. So in 2019, before that only, when Supreme Court judgment was passed, we realized there are many loopholes in the system itself, because the law existed, but many of us were not aware of it. Even police and the private hospitals, which are the key parties to the law, they were not aware of the fact that something like this has happened, and we need to follow certain SOPs if we are handling a accident victim, or even a good Samaritan who's helping the accident victim. So there are different forums in Rajasthan, like this Traffic Management Committee, which is chaired by Chief Secretary. Then the State Road Safety Council, chaired by Transport Minister. So what we did, we advocated this fact on all the forums ki different set of SOPs has to be issued for police and for medical department, that is the private hospital. Because in Rajasthan, in government hospitals, that's not the problem. People are being treated here free of cost. So basically the private hospitals and the police. And as you know, in our state, there is a very, the city and semi-urban and the rural areas, but there are different geographic and demographic conditions here. So, floating the information in different kind of areas is a task in itself. So there are tribal areas also, there are rural areas, there are semi-urban areas, and police, even the police personnel are from these different backgrounds. So we were communicating with people from different backgrounds. So we help the government in designing the SOPs, ki what kind of communication should be put to police, ki these SOPs should be followed, and similar for the medical and health department. So these two notifications were issued by the respective departments for their team members. But then as an NGO, we thought this is not sufficient. Okay, they have issued the circulars, they will be circulated in different departments. What as an NGO we should do to make aware the community? So now when I say community, it covers everyone, right from engineers, concessionaires, NHAI personnel, toll plaza staff, police department, even transport officials who are involved in enforcement. Then of course our education institutions, not only school students but college and universities, and business association leaders, and people which are there on the road, which are next to the road. These kind of peoples are a segment. So we started training with these different segments. We started different kind of workshops with them, just to make them aware ki what is the law and how they can help in case of accident. So this is one example. Like with the help of the medical department, we organized workshops with private hospitals in different districts of Rajasthan, wherein a dialogue was created ki how you have to treat a person and how you have to follow the SOPs of the Good Samaritan law, keeping in mind he don't get into this medical legal complications, because generally private hospitals don't admit the patient saying ki there's a medical legal complications which are involved, and then who will fund the treatment and all. So all those dialogues were established with the authorities along with the hospitals in different in different districts of Rajasthan. Also parallelly we started having dialogues with the police, and not only police, with police we also started giving first responder training, because generally in India they are the first people who reach there. Of course the shopkeepers and the people which are there on the road, they are there, but still police is the one who comes there to handle the accident victims. So we started giving training to them with the help of medical professionals, ki how all those things which my previous co-panelist was stating. So these kinds of training were given to police, to toll plaza staff, to concessionaires team, to there are mandals which are right next to the highways, adjacent to the highways. So these were the priority segments. And of course to college universities, students from NCC and NSS, NCC cadets and all that. Plus we also used influencers, like when a doctor is speaking about something, be a good Samaritan, it's usually help. So not only in social media, other ways also we started using influencers who can actually talk about the law, and who can be role models for general public. So then there were teachers involved, doctors involved, people from professors from universities and all that. So we roped in all these segments. And of course we created different posters and all to be placed in spaces wherein we get that kind of audience, like for just to have the pulse of the youth. We place these posters in the cafes and chai tapris and all that, these kind of locations. So we try to cover each and every segment. The only objective was ki, right from a school student to an engineer to a police wala, they all should know what is their duty. And there's this word, something like Good Samaritan, which has come into existing, and we have to follow it. There is no other option for that. And then these are the tools of awareness. Like there's another NGO which work with runaway children, so we roped them also, and through them we did street theaters and public places. Again, everything was on the theme of helping the road accident victims. And this is quite recent. So Rajasthan has established a skill lab in SMS trauma center with the help of Jay Prakash Narayan Trauma Center in Delhi, with the help of the experts from that institute. We have also established a skill lab wherein a proper one-day workshop on first responder training is being given to police personnel in the first phase. And again later on government will be roping in other segments also to give a proper certified training of treating an accident victim. So this is quite recent, this month only we have started with these kind of trainings. The pictures on the slide shows the Secretary and Transport Commissioner and Principal SMS Medical College, Dr. Sudhir Bhandari. So these people, with the help of these people, this particular thing was being possible. The idea was, as I shared, each and every segment should know about Good Samaritan. And it's only successful when we as a road user know our duty, and we as an administration know our duty, how we have to fulfill it. So both the ways it will work. It will never work one way, like hum khali, if we only talk about be a good Samaritan, be a good Samaritan, and hospitals are not actually ready to take the victims, so there will be a gap. So the key parties are police, hospitals, and the road user, and three of them has to be work in close coordination and collaboration. So thank you. This was about the case study, and rest I think we can discuss through question answer round if anything else is to be asked.
Thank you so much. We really appreciate your idea on how you have promoted the idea of being a good Samaritan. No matter who is on the road, we all share the equal responsibility to help a person in need. Thank you so much for sharing your views over the topic. I would like to welcome our next panelist, Miss Jujula, principal from Sri Balaji International School, renowned contributor in the field of education for 24 years now. She is currently working on her PhD in life sciences. She brings with her rich and varied experience gathered over the years with state, CBSE, IGCSE, IB board both in India and abroad. Ms. Rajula has inspired and encouraged generations of students and motivated them to keep up the study of life sciences. Over to you, ma'am.
Ma'am, you're on mute.
I'm sorry. I'm really sorry. Good
We
evening
welcome you,
to
ma'am.
one
Good
and all.
evening.
Yeah. Actually, I'm really honored to be invited here for this event. And sincere thanks to the organization who pointed me out and picked me up for this. Uh, what we do in schools is only that I can see, because all my co-panelists have been explaining to the proper. They have told us everything that we need. And even I today have learned many things which I never knew. So it's all learning experiences. And road safety is a very important skill set which we should inculcate in students. Because a child who learns about traffic rules and road discipline will grow up to be a law abiding citizen. The habit of obeying traffic rules teaches a person a sense of responsibility, empathy for others, and also respecting the person's right. So it's all what we can do in school is teach the students what is road safety uh, through value education. But the subject is like we can inculcate them and make them understand the awareness of road safety, which helps in preventing accidents, injuries, particularly in the context of increasing volume of traffic on the road. So there are small practices which we can show them and tell them through role plays, demos. There is a traffic park where we can take them and show a demo where how things are done. What is a zebra line? How to cross it? See children and even big adults, they just cross on the road. They don't even check how to cross, where to cross. They're on the phones. So many things. This we can teach them in school. Never run on a street, playing on the road. They have cricket going on the road, center of the road. Then you should not run on the bends or curves. All these things are very dangerous. More than anything, I feel that parents and teachers have to be acting as role models to the students so that students learn from us. Students need to take care of themselves as well, and then they can provide help to the victims of accidents. They should be familiarized to the concept of golden hour. That is, which is very important. A child just looking at the trauma there happening, the victim lying down and just not reacting is not good. We can teach them proper first aid. Even a small child can do. Call a ambulance or a police, 108, which is a free emergency response service. 108. So you can just call. You can reduce the severity of injuries and increase the chances of survival. Children can inform the police, talk about what they saw on the spot of accident, prompt medical attention, which, see, this prompt medical attention can save one's life, which a child should understand. So they can call, they have to learn few numbers, 102. Everybody has a phone these days. They can use it or ask their friends or their relatives. It should be fast as they have to be knowing about the golden hour. Once they know the golden hour, they'll be reacting. So these can be inculcated and the students teach in school, make them understand what is what. So another thing is when you see an accident, you see all people and even the children running, just getting gathered there. The victim doesn't get enough air to breathe, as the doctors told us that it is important that they need fresh air, they need oxygen. These things can be taught in school. Students should have that basic idea of basic emergency care techniques and the first aid, also the CPR. I have just understood that the we can do very less in school as certain limitations to school. Rest is all under the control of government and agencies. So engineering, educating, enforcement, which can be done in adults. And I've just outlined the basic skill sets pertaining to road safety from the point of view of students. Rest, I think all the doctors have told us. Thank you. Thank you so much.
Thank you so much, ma'am, for sharing your views. The previous year was very special for a lot of reasons. One major reason was the Road Safety Month instead of week by the Ministry of Road Transport and Highways. The theme of this year was Sadak Suraksha Jeevan Raksha. SHARP, through its various interventions, is supporting the goals of the ministry. Before starting the Q&A round, I would like to introduce a short video encapsulating our journey in the Road Safety Month. We mobilize communities, youth centers in and out of school, children, and teachers to spread the momentum of road safety as a movement. While we go through the video, I request all the attendees to please post the questions in the Q&A box. The sharpest question of the webinar stands a chance to win a gift voucher of rupees 1,000 from Sharp.
मेरा नाम तनु मौर्य है। मैं जीजीआईसी इंदिरानगर पढ़ती हूँ और आज हमारे स्कूल में रोड सेफ्टी का बहुत बड़ा इवेंट था, जिसमें हमें रोड सेफ्टी के नियम बताए गए और उसके बारे में कई बातें बताई।
मैं प्रतिज्ञा करता हूँ किसी पीड़ित की मदद करने से संकोच न करें। दुर्घटना से दुर्घटना से दुर्घटना से
Thank you, Ritik, for playing the video. And now we start with the first round of question and answer round. And I once again request all the audience to put the question in the Q&A box and then raise your hands that we are able to unmute you for the live questions. So now first I would like to invite from the audience, Veluru Ramesh. Veluru Ramesh, please unmute yourself and then ask your question.
Ma'am, good evening.
Good evening.
Good,
Please,
good evening.
please
Am I
introduce
audible?
yourself.
Am I audible, ma'am?
Yes, yes.
Thank you. Very good evening to all distinguished speakers and host also. I have some queries like basic life support. While a road accident, there is need to give basic life support. So how do you provide and facilitate emergency services to trauma patients? How we open the airway? How we identify the pulse before performing CPR? Conditions and advisors while performing CPR. Time importance. There is some time bounds. So time is very crucial time. So time, how we manage the time in the case of trauma and medical emergencies. If we performing CPR, how did we provide them compression depth, compression rate, and rescue breath durations to different age peoples like children, infants, and adults. And I want to know, I would like to know that golden hour and platinum time and silver time and differentiation and their importance. And how did we use arteries while bleeding control? Because there is open injuries, close injuries, there may be happen. So how you use the arteries to control bleeding? Thank you, ma'am.
Dr. Sushma Sagar. Yeah, would you like to? Yes, ma'am.
Thank you, Dr. Ramesh, for this interesting question. In fact, you have asked all the questions which are required to conduct any first responder workshop. So basically, there are various ways. The National Institute of Disaster Management runs a course program of about 7 days for all the teachers and the administrative officers, wherein the doctors go and they conduct this workshop. They have their road safety manual for school children, which is available on the website of National Institute of Disaster Management. Then Save Life Foundation also runs the first responder programs. There are various other NGOs which, with the help of the faculty of trauma center and other medical departments, like Indian Road Safety Campaign, they also conduct these workshops for the bystanders and for the school students. And if you visit the website of IRSC, Indian Road Safety Campaign, and they have very many YouTube videos also being uploaded, which will clearly tell you how to do a CPR, how to open the airway, how to do the pressure bandage for the bleeding vessel. So this cannot be told here because we don't have the mannequin wherein I can demonstrate all those things to you. So you need to visit these NIDM site or the IRSC YouTube videos to learn all this, or you can contact any nearby NGOs who conduct these first responder programs. Now, regarding the golden hour, for Indian circumstances wherein the pre-hospital services are not existing. In the West, what happens is if any accident occurs, there is a proper transportation and pickup mechanism wherein the nearby ambulance reaches to the victim and takes him to the nearby hospital. So that kind of pre-hospital care is not existing in India. So in whatever time you can shift your person from the accident site to the nearest hospital is taken as a golden hour. So ideal golden hour is 1 hour, but in India we say that even if you make the patient reach to the hospital within 3 to 4 hours, even up to 6 hours, it will be considered as golden hour. Thank you.
Thank you so much, ma'am. And the next question is from Dr. Abhishek. Dr. Abhishek, please unmute yourself.
Hello, ma'am.
Hi, Dr. Abhishek. So yes, where are you from?
Hello, ma'am. Myself, Dr. Abhishek. I am from Noida International University, New Delhi, and I am a medical practitioner and public health specialist. And previously, I worked in Malaysia. So, just I have one question to ask about how to develop life skills in government school students and how to analyze life skills in government school students. So, how will we do the development skills in government schools?
Neha, ma'am, would you like to answer?
See, as Dr. Sushma said earlier also, you need to contact, the NGOs working in your areas. So there are many individuals and NGOs who are trained, who are using trained professionals who are working there. So with the help of those people, you can conduct workshops and training sessions in government schools also. And plus, I think Dr. Naveen wanted to add something.
Ma'am, you can complete. After you, I'll speak.
So, and plus, you can directly approach the education department, school and higher education also, and they have already issued the circulars for road safety clubs in all the government schools. So through those road safety clubs also, you can get a particular group of children trained as master trainers, and then they can continue the trainings. The whole thing depends on how you are able to contact the right person in your area. So as ma'am said कि IRSC भी इस पे काम कर रहा है, plus Save Life Foundation is also doing. So there are NGOs in Odisha also, Maharashtra also, United Ways in Maharashtra, tracks in Delhi. Then there is Accident Forum in Odisha. So there are different states. So individually you can connect. If you want a list of people who are working in this field, those who all, they can connect with me, and I can provide you the resource person list, and with the help of those resource person, you can organize these trainings.
Yeah, thank you so much, ma'am.
May I add a couple of things here? Hello?
Yes, sure, sir.
Yes.
Yeah, thank you. I would talk about a different. I don't know if the questionnaire was related. I mean, because there is a life skills concept also has been given by the WHO, wherein life skills are defined as abilities for adaptive and positive behavior that enable individuals to deal effectively with the demands and challenges of everyday life. And these life skills are actually being taught by various schools in India, as ma'am was saying, even in government schools. So the important life skills are, say, for example, decision making, problem solving, creative thinking, critical thinking, effective communication, interpersonal skills, self-awareness, learning empathy, coping with emotions, and coping with stress. So all these, I think WHO has given, I mean, again, a lot of material is available with the WHO. WHO is the one who has, which has advocated this particular concept, and it's shown that children, while they grow up, if they learn one after the other these skills, their psychosocial competence while they grow up will be better. And he was also asking about how to evaluate these life skills. Now, some of the questions that can be after, I mean, a lot of simple workshop formats are there, and many experts are there, who can come to the schools and do these life skills workshops, so that the teachers can be trained as master trainers, and then the teachers can teach the students. I mean, after all, these are not very a difficult thing to do. And once we do the workshops, the outcomes can be like, for example, have the questions that can be asked to evaluate the outcomes are, do the children learn the life skills? Are there any indications of change in health related behavior of children? Are there changes in indicators of mental well-being? For example, is a child's self-esteem better, or is the child's self-confidence better? Is there improvement in teacher-pupil relationships? Improvement in academic performance is another outcome that one can study. Is there a reduction in school dropout rate and improved school family links? So these are some of the ways in which one can evaluate life skills education. Thank you.
Yeah, adding on to Sir, we Sharp NGO is also having road safety clubs in 4 cities: Noida, Lucknow, Chennai, and Bangalore. And we also organize a lot of activities and workshop through teachers, and with the support, not only with the support of the teachers, with the support of the traffic police, we are doing these workshops in different areas. Moving on to the next question, I would like to invite Nagarjan Krishnamurthy from the audience. Please unmute yourself and then ask your question. Nagarjan?
Hello.
Yes.
Good evening.
Good evening. Good evening, sir. So please tell.
Madam, I think.
Yes, sure.
I think our education system should be remodeled to make the students at a school level and college level to know the first aid knowledge and traffic knowledge and disaster rescue knowledge. But we have not included such education subjects at all levels. We see many disasters where we are not responding properly, so that only many human losses and economic losses. We are not having the awareness how to be prepared and to respond. What are your suggestions to government?
Yes, doctor.
Yeah, first I would like to inform you that in the syllabus by the CBSE, there is a chapter in class 10th social studies wherein they cover the topic of disaster and rescue behavior and all the topics, and in fact the life-saving skills and the basic life support sensitization. There is a chapter on that, and students are made to learn that chapter and teachers are made to teach that chapter. Moreover, I am aware about the Delhi schools that regularly there are mock drills and such type of workshops are being conducted in government schools as well as in the private schools, wherein the teachers are first trained through the NIDM, and then the teachers as a part of the training, they impart the same training to their students. Thank you.
Hello?
Yes.
Madam, to my opinion, including myself, we are having the education system testing the memory power only, not having the education system of life leading education system.
Yes. We understand that, but there are a lot of other things, as ma'am said, that some of the education system is moving, it's like through NGOs, we are changing some of the education system and we are educating the children. Moving on to the next question. My next question is from Sushant Sagar. Sushant Sagar, please unmute yourself. I guess there's some connection issue with Sushant Sagar. I will move on to the next participant, Mr. Satya Prakash. Please unmute yourself. I will read out the question of Mr. Satya Prakash. This is for Dr. Sushma. If the rib breaks due to the chest injury at the time of the accident, can CPR be given?
Yes, sir. Ideally, if you are breaking the ribs, that means you are giving a good CPR. So we always say that a good CPR means breaking of the rib. Ribs can heal on their own, and breaking of rib is not going to kill the person, but a good CPR can definitely save your patient.
Thank you so much, ma'am. Now I would like to invite Aliza for the next round of the questions.
Okay, so here we start our next round of questions. The next question is from Meera Jan Kiraman. Meera, please unmute yourself. Meera, am I audible to you?
Hello, can you hear me?
Yes, yes.
I have a question. Actually, I stay at Kolkata. In our street, what we find that two bus drivers of the same route, public bus mainly, there is always a competition between the two. One, if in the same route, if the back one reaches the faster ahead than the first one, then they get a more commission. Due to this, they are the main cause of accidents. Can you tell me how, as a general public, how can I approach, whom to approach so that we can, I cannot go to the transport department. I don't know whom to approach so that we can avoid these accidents before. The whole topic was once the person falls into a victim of accident, what to do. But I'm only thinking how we can prevent the accident itself in the first time. That is my question.
Anyone from the panelists would like to take up this question? Yes, Ms. Neha.
That's a very good thought. We should try and avoid accidents. So the case which you are saying is of road rage also. And see, there's not only one contribution to road accident. There are various fatal factors, and road rage is among one of them. So coming straight to your answer, to cut short everything, I think if you as an individual want to approach, the right authority is the enforcement wing, which is with traffic police and transport department. So try and contact the traffic police team in your city first to report these kind of accidents. And if I'm saying ki go and approach them, I'm not assuring you ki you will be getting a very good response. It completely depends on the the police personnel who are sitting there, what kind of, whether they are pro to community participation or not. So it completely depends on the officer which is sitting on that seat. But yes, you can approach traffic police, and this is the issue of enforcement. Secondly, what you are saying, they get more commission because of if they reach faster. So these are different level of advocacy issues which all the NGOs should take up together, because the public transport is a big issue for our country, though it should be the backbone, but it's becoming an issue because there's a lack of public transport policy in all these states. So there are few states which are working quite good, but if I take example of Rajasthan, we are actually lacking public transport opportunities. So there are education hubs where we need more buses or more autos or Tata Magic to be plying on that road. But in absence of that, I've seen students hanging on that Tata Magic and going. So when I say ki police should enforce it properly, but then I don't have any answer to it ki if they will enforce it, what is the option available with students to go to their college? This is one kind of example I'm giving. So the problem is not only the enforcement, problem is much deeper, and a lot of work has to be done on the public transport policy at national level for all the states, so that these kind of fatal reasons can be avoided. I hope I was able to answer your question.
Thank you, sir.
My next question is from Shravani. Please unmute yourself.
Hello.
Yes.
Am I audible to all of you?
Please, yes, you are audible. Please introduce yourself and follow up with the question.
Okay. Good evening, all of you. My name is Shravani Abhijit Pardeshi. I am from Pune, Maharashtra. So my question is, what is the mandatory requirement as per HCCBPL in road safety? And in my place, I am seeing that there are a lot of accidents at night time. So how can we stop that? Thank you so much.
Dr. Naveen, would you like to take up this question?
No, I don't think this question comes under my competence.
Ms. Neha, would you like to take up?
Yeah, see, second part I can take. The first I didn't get what was the question was. Second part I can take you there. How can we avoid accidents in the night? Who has asked the question? Can you introduce yourself?
Shravani, please introduce
yourself. Shravani, you are studying? You are studying?
Yes, ma'am. I'm a student.
Yeah. Which class?
I'm in 8th class, ma'am.
Okay, 8th standard. So, Shavni, there are many reasons which are, causes of fatal factors during daytime also and nighttime also. And it is related to speed also, the road conditions, and, whether the vehicle fitness is there or not. So there are many reasons. I can't name any one. And, how to avoid them, I guess there should be a proper session, defensive driving session, wherein we can understand the causes and the preventions to avoid accidents. If I want to list out one or two, then it's like you need to be more visible in night, you need to control your speeds, you need to have your vehicle fitness in place, and plus you need to, if you are aware of your area, if the road infrastructure is not safe in that particular road where you're driving, you have to be more cautious. So these are the few tips I can share on this platform. Otherwise, it's a whole lot of different topic of having a defensive driving session wherein we can discuss it in detail.
So I please request to Sharp and Geo that they can take this topic and they can make a session on it.
Sure. Thank you, Shravani. Our next question is from Anuradha Gupta. Please unmute yourself.
Good evening.
Good evening.
I'm Anuradha Gupta from Kolkata. I'm a teacher. I would specifically like to ask about road accidents. I've been a witness to one, and I've seen that during such an accident, maybe there are multiple people who have been injured and multiple casualties, where the first aiders are outnumbered by the number of casualties, and it can be extremely overwhelming. And the right decision and the right action at the right time can save lives and control damage. So, if you could tell us how to prioritize whom to attend first, whom to rush to the hospital first, when you have multiple cases lying in front of you.
Yeah, right? See, that's why whenever you have any casualties, whether it is in the hospital, whether it is on the road, or whether it is a disaster, there are various ways by which the first aid team or the disaster response team work. So there is a method called triage, wherein we triage the patient. We try to filter out the patient in red, yellow, and green and black. So red are the ones who require immediate care. Somebody who's got problem with his airways, somebody whose pulse is not felt, or somebody who's choking, or somebody who's bleeding heavily. So these are triaged as red and they are shifted to the hospital immediately. Then there is a second group of patients who have some fracture kind of injuries, but they are conscious enough and they can wait. So they are the second in line. Third ones are the ones who've got just minor injuries or bruises or some kind of pain. So they are triaged as green and they have to wait for a certain period of time, and they are the ones who are transferred to the hospital in a different phase of time at a later time. Now, when you are transferring them to the hospital, then also you are again triaging them. Those who are more sick are referred to a better hospital or a tertiary care hospital or a level 1 center. Whereas those who's got minor injuries can be shifted to the nearby dispensaries or nursing homes, such places. So there is a way of triaging, and that triaging has to be done by the most experienced person who's available there, maybe a senior medical officer or a senior disaster response team member. So they are the ones who do this, and they decide that which person has to go where and who are the ones who need to go early to the hospital. Thank you.
Thank you so much, ma'am. My next question I will be taking from Sanjeev Parashar. Please unmute yourself, Sanjeev. Okay, so the question from Sanjeev Parashar is, it has happened many times with him कि उनका एक्सीडेंट देखा कि अगर वो एक्सीडेंट देखे तो पुलिस को कॉल ही कर दे, लेकिन फैमिली मेंबर्स का सोचकर चुप रहते हैं बिकॉज lot of information and personal information is being taken up in the hospitals.
Should I answer? So I think we have discussed it during the panel discussion also. As I said कि though there is a law in place, Good Samaritan law आ चुका है, लेकिन अभी उसका जो penetration level है, knowledge, awareness level है, वो लोगों में भी काफी कम है. तो इस तरह की difficulties अभी आप face कर सकते हो, but I won't say कि आप मतलब things are not changing. Things are changing. अभी बहुत से लोग aware हो चुके हैं. So I don't think so this one bad experience should stop you from helping the other victims. So abhi at least you know your rights. आपको अगर rights पता है तो आप सामने वाले से argue भी कर सकते हो कि you legally you can't ask for any money in my name or you can't detain me. तो आप at least अपने rights को जाने और कोशिश करें. बाकी अगर बदलाव की बात है तो वो तो धीरे धीरे ही आएगा, and you know everybody is working towards it कि ये change आए.
You're on mute.
Thank you so much, ma'am, for answering the question. My next question is from Rahul. Rahul, please unmute yourself.
Hello.
Yes.
Myself, Rahul. Me basically belong from Maharashtra, and I am working as a health safety professional. My two question is there: can our country will start to education from first or fifth standard to educate the child? How can reduce or practically control road accident to prevent medical emergency? Or if emergency is there, what to do save the victim life? And another one is can NGO government will only control the accident of road? Our new growing educated and who have awareness to how safely walk through road by people means behind of it. My question is that कि हम अगर अपने स्टूडेंट्स को एजुकेट करना स्टार्ट कर देंगे तो क्या हमारे स्टूडेंट आके जाके जो बड़े होने वाले वो एक्सीडेंट प्रिवेंट करने के लिए कंट्रोल कर सकते हैं कि नहीं? उसके लिए हमारा गवर्नमेंट मतलब जो पेरेंट्स वगैरह है उनको वो बच्चों को एजुकेट करना चाहिए कि नहीं चाहिए? हेलो
नेहा मैम, would you like to answer?
या सी आप जो बात कर रहे हैं बच्चों को एजुकेट करने की, तो अगेन इसमें भी कुछ स्टेप ऑलरेडी गवर्नमेंट ले चुकी है. लाइक मैम ने भी शेयर किया था कि सीबीएसई ने ऑलरेडी रोड सेफ्टी का करिकुलम इंक्लूड कर लिया है, और अभी से नहीं, राइट फ्रॉम 2005 से ये कोर्स करिकुलम इंक्लूडेड है सीबीएसई स्कूलों में, और टाइम टू टाइम वो उसको अपडेट भी करते हैं. अब जरूरत ये है कि हम इसी करिकुलम को या रोड सेफ्टी के करिकुलम को रीजनल लेवल पे भी अडॉप्ट करें. जहां सीबीएसई स्कूल्स नहीं है तो रीजनल बोर्ड्स जो हैं उनको भी इसको अडॉप्ट करने की जरूरत है. तो जैसे अगेन मैं आपको काफी स्टेट्स में, जैसे मैंने आपको बताया कि अगर सीबीएसई बोर्ड नहीं भी है तो भी वहाँ रोड सेफ्टी क्लब्स जरूर है. तो थ्रू रोड सेफ्टी क्लब्स इस तरह का कोर्सेज अडॉप्ट करने का पैटर्न शुरू हो चुका है. और सबसे पहले जब रोड सेफ्टी एजुकेशन की बात आती है ना, तो स्कूल के बच्चे ही याद आते हैं सबको, गवर्नमेंट को भी और एनजीओस को भी. तो स्कूल के बच्चों को तो ऑलरेडी सबने घेर रखा है पढ़ाने के लिए. अब यही है कि वो जो करिकुलम पढ़ाया जा रहा है उसको टाइम टू टाइम अपडेट करने की जरूरत है, रीजन स्पेसिफिकली उसको डिजाइन करने की जरूरत है, क्योंकि हर स्टेट की अपनी अलग कंडीशंस होती हैं. और जिस तरह से जैसे नया मोटर व्हीकल अमेंडमेंट एक्ट आया तो उसको उसमें इनकॉर्पोरेट करना, प्लस कोई भी नई इंफॉर्मेशन जो कि जरूरी है बच्चों के लिए उसको इनकॉर्पोरेट करना. और एक जो चीज अभी मिसिंग है हमारे एजुकेशन में वो है पेरेंट्स का एंगेजमेंट. जनरली स्कूल्स एंगेज नहीं कर पाते हैं बिकॉज लैक ऑफ टाइम. जैसे एक इकलौती अपॉर्चुनिटी मिलती है पेरेंट्स टीचर मीट पे, वो भी बिकॉज ऑफ लैक ऑफ टाइम वी आर नॉट एबल टू एंगेज पेरेंट्स. बट काफी स्कूलों में पेरेंट्स एसोसिएशन भी होती है तो उसके थ्रू हमें एंगेज करना चाहिए. एंड आई थिंक Jujla ma'am can throw some light on this if she's there with us right now.
No, she left. She was not well. I would request Naveen sir to please add on this.
No, I agree with what my co-panelists are saying, and I think I would take one more question also. It's what is the important age to teach these skills to students, as explaining accidents to them could itself be a little traumatic? That is another question that I would like. So I don't think, although it seems that it could be a little traumatic, but it's too precious for everybody to learn. And maybe at fourth or fifth class level itself, these concepts should be inculcated. and I think I think that's about it. There is no two thoughts on that.
Thank you so much, sir, for sharing your views on this. So here we end the question and answer round. Would you like to add something, Sharon? You are on mute, Sharon.
I really like to thank all the panelists for being here with us and answering all the questions and the queries which our participants had. I once again thank Dr. Sushma Sagar, Ms. Neha Kular, and Dr. Naveen Kumar, and the principal who was here, but she left due to as she was unwell. And now we come to the end of the webinar. Aliza, would you like to announce the winner of the sharpest question?
Yes, Sharon, I would say the winner of the sharpest question for today's webinar is Dr. Anuradha Gupta.
Congratulations, Dr. Anuradha. And Sharp Communication team will get in touch with you. I once again thank everyone, all the participants and the panelists. Now we have the feedback form on your screen. Please fill the feedback form.
So there is a poll right on your screen. Please take a moment to fill this form. It will be very useful for us to have your feedback. And thank you for attending, all the panelists and attendees. Over to you, Sharon.
For your certificates, you will get all your certificates in 2 days. And for further updates on our webinar and our projects, please log on to www.schoolindia.org.in. And we are also participating in the National Speed Challenge by MOT. I would really like all the audience to please check their website and take the pledge. And we have also dropped in the link in the chat box. Please go and take the pledge. And now I really want to thanks all the panelists. Dr. Sushma, would you like to say anything? Ma'am, you're on mute.
Thank you so much, and I really appreciate this effort by you and the kind of response you've generated among the audience. And I could see that there were more than, at one point of time, there were around 250 people who were logged in. And congratulations to all of you for conducting this webinar. Thank you.
Dr. Naveen?
Yes, I would echo the sentiments of Professor Sagar. What was heartening to know is that to bring in the component of mental health. I think that's a new concept, and I think the issue of mental health in these disasters also needs to be given due importance. So thank you for bringing that. Thank you.
Ms. Neha Kular.
Yeah, same here. Thank you so much for having me here. And I would like to say ki in case further also if any kind of clarification query you guys have, even Sharp NGO and the participants, so you can always connect with me, and I'll be sharing my details are with Sharp NGO, so you can take those details from them also.
Definitely, ma'am. Thank you so much.
I would yes, Aliza, please.
Thank you all the panelists, all the attendees for joining us and coming and sharing your time with us in such busy schedules. I would again request all the attendees and panelists to please fill up this form. This will be very valuable as a feedback for us.
Thank you so much for joining us for the webinar.
Thank you, everyone.